Your liver is processing toxins right now. Not occasionally, not when you drink alcohol or take medication, but continuously every single minute of every day. It is filtering 1.4 liters of blood per minute through specialized cells that break down waste products, neutralize chemical compounds, and package toxic substances for elimination. That filtration is happening whether you are aware of it or not. Your liver is metabolizing the remnants of last night's dinner, the acetaminophen you took this morning, the preservatives in your afternoon snack, and the environmental chemicals you absorbed through your skin and lungs throughout the day. Chronic liver damage is one of the most insidious disease processes in modern medicine. It does not announce itself with pain or obvious symptoms until you have already lost 70 to 80% of liver function. Usually in the form of cirrhosis, liver failure, or hepatocellular carcinoma. The problem is that for decades we have been told that liver disease is primarily caused by alcohol abuse or viral hepatitis. Avoid excessive drinking, get vaccinated for hepatitis B, and your liver will be fine, except that has not protected millions of people. What we are now understanding is that non-alcoholic fatty liver disease has become the leading cause of chronic liver disease in the developed world, affecting nearly 1 in 3 adults, and it is driven by daily habits that most people consider completely harmless. Hi, I am Dr. Alex. I am an emergency medicine doctor, and after nearly 10 years in AAND, I have seen what happens when liver disease is not recognized until it reaches the crisis stage. And my goal now is to help people identify the daily habits that are silently damaging their liver and live longer, healthier lives. For the next several minutes, I'm going to walk you through 7 things that slowly damage your liver that most people do every single day. These are not extreme behaviors. These are common, socially acceptable, often recommended activities that are causing progressive liver injury in millions of people who have no idea this is happening. And I just want to take a few seconds here to make you a promise. I promise to keep creating the most helpful videos I possibly can, grounded in science and the latest research to help you prevent the diseases I see in the emergency department every single day. And all I ask in return is that you give this fairly new channel a chance and hit the subscribe button. If you get to the end of this video and you did not think it was worth your time or you have not learned something new, then feel free to unsubscribe. No hard feelings, but if you give me your time and your attention, I will give you everything I have learned from over a decade in medicine. So please help me out. Hit the subscribe button to help this channel reach more people like you. And let's continue with the video. Before we discuss the 7 daily habits, we need to understand how the liver actually becomes damaged and why that damage is so difficult to detect until it is severe. Your liver is made up of approximately 100 billion hepatocytes, which are the functional liver cells responsible for metabolism, detoxification, and protein synthesis. These cells are organized into lobules, which are hexagonal structures with blood vessels running through them. When your liver is exposed to a substance it needs to process, whether that is fructose from your diet, acetaminophen from pain medication, or environmental toxins from cleaning products, the hepatocytes absorb those substances and break them down using enzymatic pathways. The problem is that many of these metabolic processes generate reactive oxygen species as byproducts. Reactive oxygen species are essentially free radicals that damage cellular membranes, proteins, and DNA. When the production of reactive oxygen species exceeds your liver's antioxidant capacity, you develop oxidative stress. That oxidative stress triggers inflammation. The inflammation recruits immune cells that release cytokines, which are inflammatory signaling molecules. Those cytokines activate hepatic stellate cells, which are normally dormant support cells in the liver. Once activated, stellate cells start producing collagen and laying down scar tissue, which is called fibrosis. If the injury continues, fibrosis progresses to cirrhosis, which is irreversible scarring that disrupts the liver's architecture and impairs its function. The critical point here is that this entire process, from initial oxidative stress to advanced fibrosis, can occur without producing any symptoms. Your liver does not have pain receptors in the tissue itself. You only feel pain when the liver becomes so enlarged that it stretches the capsule surrounding it, which typically means the disease is already advanced. Damaging habit number 1 is consuming fructose in quantities that exceed your liver's metabolic capacity. Fructose is a sugar found naturally in fruit, but it is also added to processed foods in the form of high fructose corn syrup and table sugar, which is 50% fructose. Unlike glucose, which is metabolized by every cell in your body, fructose is metabolized almost exclusively by the liver. When fructose enters a hepatocyte, it is rapidly phosphorylated by an enzyme called fructokinase, and this process depletes adenosine triphosphate, which is your cell's energy currency. That depletion triggers a cascade that increases uric acid production, generates oxidative stress, and promotes de novo lipogenesis, which is the synthesis of new fat molecules from sugar. Those fat molecules accumulate in the liver as triglycerides. When more than 5% of liver weight is fat, you have fatty liver disease. Studies published in the Journal of Hepatology have shown that people who consume more than 25 grams of fructose per day from added sugars have significantly higher rates of non-alcoholic fatty liver disease compared to those who consume less. To put that in perspective, a single can of soft drink contains approximately 23 grams of fructose. A flavored yogurt can contain 15 to 20 grams. Many people are consuming 50 to 100 grams of added fructose daily without realizing it, and their livers are being converted into fat storage organs as a result. Damaging habit number 2 is taking acetaminophen regularly, particularly at doses approaching the maximum recommended limit. Acetaminophen, which is also called paracetamol, is considered one of the safest over-the-counter pain relievers when used appropriately. The problem is that the therapeutic window is narrow. The maximum recommended dose is 4,000 milligrams per day for adults, but liver damage can begin at doses as low as 7,500 to 10,000 milligrams per day, and some individuals are more susceptible due to genetic variations in the enzymes that metabolize it. When you take acetaminophen, approximately 90% is metabolized through safe pathways that produce non-toxic byproducts. But 5 to 10% is metabolized through a pathway that produces a toxic metabolite called N-acetyl P-benzoquinone imine. Under normal circumstances, that toxic metabolite is neutralized by glutathione, which is your liver's primary antioxidant. But when you take high doses of acetaminophen, you deplete your glutathione stores, and the toxic metabolite starts damaging hepatocytes directly. This is why acetaminophen overdose is the leading cause of acute liver failure in the United States and the United Kingdom. What many people do not realize is that acetaminophen is present in dozens of over-the-counter medications, including cold and flu remedies, sleep aids, and combination pain relievers. People who take a pain reliever in the morning, a cold medication in the afternoon, and a sleep aid at night can easily exceed the safe dose without intending to. Research in the American Journal of Medicine found that unintentional acetaminophen overdose accounts for nearly half of all acute liver failure cases in some populations. Damaging habit number 3 is consuming alcohol in patterns that prevent your liver from recovering between drinking sessions. The standard advice is that moderate drinking, defined as up to 1 drink per day for women and up to 2 drinks per day for men, is safe for most people. But that advice assumes your liver has time to repair between exposures. Alcohol is metabolized by the liver into acetaminophen, which is a highly toxic compound that damages hepatocyte membranes and generates oxidative stress. Your liver can process approximately 1 standard drink per hour, but the damage caused by acetaminophen takes longer to repair. When you drink multiple days in a row, even within the moderate range, you are creating a situation where your liver is being re-injured before it has fully recovered from the previous injury. This is particularly damaging for women who metabolize alcohol differently than men due to lower levels of alcohol dehydrogenase, the enzyme that breaks down alcohol in the stomach. Studies in hepatology have shown that women who consume as little as 2 drinks per day, 5 or more days per week, have significantly elevated rates of alcoholic fatty liver disease and fibrosis compared to women who drink the same total amount but with rest days in between. The pattern of consumption matters as much as the quantity. Damaging habit number 4 is eating meals within 3 hours of going to sleep. When you eat late in the evening, particularly meals high in carbohydrates or fat, you are asking your liver to process nutrients at a time when it should be engaged in repair and detoxification processes. Your liver operates on a circadian rhythm. During the day, it is primarily focused on metabolic functions like glucose regulation and nutrient processing. At night, it shifts to detoxification, cellular repair, and autophagy, which is the process of breaking down and recycling damaged cellular components. When you eat late, you force your liver to continue metabolic work instead of transitioning to its repair phase. This disrupts the circadian regulation of liver enzymes and impairs autophagy. Research published in Cell Metabolism found that mice fed the same diet but at different times of day developed dramatically different liver outcomes. Those fed during their normal rest period developed fatty liver disease, insulin resistance, and elevated liver enzymes, while those fed during their active period remained healthy. The timing of nutrient intake has independent effects on liver health beyond the composition or quantity of the diet itself. Damaging habit number 5 is using cleaning products, personal care products, and air fresheners that contain volatile organic compounds without adequate ventilation. Your liver is responsible for detoxifying chemicals that enter your body through all routes, including inhalation and skin absorption, not just ingestion. Many common household products contain compounds like formaldehyde, toluene, benzene, and phthalates, which are metabolized by the liver through the cytochrome P450 enzyme system. The problem is that these chemicals generate toxic metabolites and reactive oxygen species during metabolism, which cause oxidative stress and hepatocyte damage. When you use these products in enclosed spaces without ventilation, you are creating continuous low-level exposure that requires constant detoxification activity from your liver. A study in Environmental Health Perspectives analyzed the chemical exposure levels in homes and found that people who regularly used conventional cleaning products and air fresheners had measurably higher levels of liver enzymes and markers of oxidative stress compared to those who used low-toxicity alternatives or ensured adequate ventilation. Your liver is working overtime to process chemicals that most people assume are harmless because they are legally sold for household use. Damaging habit number 6 is sitting for more than 8 hours per day without breaks for movement. Physical inactivity is not just a cardiovascular risk factor. It is a direct contributor to liver fat accumulation and insulin resistance. When you sit for extended periods, your muscles are not contracting, which means they are not taking up glucose from your bloodstream efficiently. That glucose stays elevated, which triggers insulin release. Chronically elevated insulin drives fat synthesis in the liver and inhibits fat breakdown. Insulin also promotes the uptake of free fatty acids from your bloodstream into liver cells, where they accumulate as triglycerides. Studies in the Journal of Hepatology have demonstrated that people who sit for more than 8 hours per day have significantly higher rates of non-alcoholic fatty liver disease, independent of body weight, diet, or total physical activity levels. Even if you exercise for 30 minutes in the morning, if you then sit for 8 consecutive hours, your liver is still experiencing prolonged periods of metabolic dysfunction. Breaking up sitting time with short movement breaks, even just standing or walking for 2 minutes every 30 minutes, has been shown to reduce liver fat accumulation and improve insulin sensitivity. Damaging habit number 7 is chronic sleep deprivation, particularly getting less than 6 hours of sleep per night on a regular basis. Sleep is when your liver performs its most intensive repair and detoxification work. During deep sleep, your liver increases the production of enzymes involved in phase 1 and phase 2 detoxification, which are the processes that neutralize toxins and prepare them for elimination. Sleep deprivation disrupts these processes. It also increases cortisol levels, which promotes insulin resistance and drives fat accumulation in the liver. Research in the Journal of Clinical Endocrinology and Metabolism found that people who slept less than 6 hours per night had significantly higher liver fat content and elevated liver enzymes, compared to those who slept 7 to 8 hours, even after controlling for diet, alcohol intake, and physical activity. The effect was dose-dependent, meaning that each hour of sleep loss was associated with progressively worse liver outcomes. Chronic sleep deprivation also impairs autophagy, which is critical for clearing damaged proteins and organelles from hepatocytes. Without adequate autophagy, damaged cellular components accumulate and contribute to oxidative stress and inflammation. Now here is what most people miss. These 7 habits are not extreme. They are normal behaviors that the majority of adults in developed countries engage in daily. Having a soft drink with lunch, taking acetaminophen for a headache, having a glass of wine with dinner several nights in a row, eating dinner at 8 p.m. and going to bed at 10 p.m., using conventional cleaning products, working a desk job, sleeping 6 hours a night. None of these seem dangerous in isolation, but when they occur together, which they do for millions of people, they create a cumulative toxic load that exceeds the liver's capacity to repair itself. The result is progressive fat accumulation, inflammation, and fibrosis that advances silently for years or decades until the damage becomes clinically apparent. So what actually protects liver health? 3 primary mechanisms. First, you need to reduce the metabolic burden on your liver by eliminating or significantly reducing added fructose intake, spacing alcohol consumption with rest days, and avoiding late-night eating. This gives your liver the capacity to shift from constant metabolic processing to repair and detoxification. Second, you need to support your liver's antioxidant systems by ensuring adequate intake of nutrients involved in glutathione synthesis, particularly cysteine, glycine, and glutamine, which are found in high-quality protein sources. You also need to minimize exposure to chemicals that deplete glutathione, which means being selective about pain relievers, household products, and environmental exposures. Third, you need to promote insulin sensitivity through regular movement, particularly resistance training and breaking up prolonged sitting, combined with adequate sleep to allow normal circadian regulation of liver function. Studies have shown that these interventions can reduce liver fat by 30 to 40% within 3 months, even without significant weight loss. In emergency medicine, we see liver disease when it has reached the point of decompensation. Ascites, which is fluid accumulation in the abdomen. Hepatic encephalopathy, which is confusion caused by toxins the liver can no longer clear. Variceal bleeding from portal hypertension. By the time patients are experiencing these complications, the liver damage is often irreversible. What becomes clear when you work on the front line is that liver disease is almost entirely preventable. The patients who avoid these outcomes are not the ones with superior genetics or expensive supplements. They are the ones who recognize that the liver has a finite capacity for repair and who structure their daily habits to stay within that capacity, rather than constantly exceeding it. So where does this leave you? The 7 habits we have discussed are not definitive causes of liver disease in every person. Individual susceptibility varies based on genetics, age, sex, and other factors, but they are well-established contributors to liver injury that are operating in millions of people right now. If you are engaging in multiple of these habits simultaneously, you are creating conditions where liver fat accumulation, inflammation, and fibrosis are likely occurring even if your liver function tests are currently normal. The goal is not to eliminate all enjoyment from life or to live in fear of every substance you encounter. The goal is to understand that your liver has limits and to make conscious choices about where you allocate its detoxification capacity. Because once liver damage progresses to cirrhosis, there is no reversing it. You can only prevent further progression, and finally, please subscribe to the channel if you found this useful to help me reach more people like you.